As the migrant crisis continues, services are expanding at the Respite Center in McAllen.
Channel 5's Christian Colon takes us inside the facility where medical professionals are now on standby.
Thousands of immigrants make their way here into the McAllen Respite Center, waiting until it's time to reach their next destination. But before that, they make a stop at the doctor's office. 10-year-old Alessandra and her twin sister Andrea are feeling under the weather. They came from Honduras with their father.
I think the climate affected us, from hot to cold. It messes up our health, such as our throat.
The Mariagas are seeking the medical attention they haven't gotten in 2 months. This visit lasts for less than 10 minutes. The Mariagas are thankful.
I did it because we needed to. It's complicated to live in our home country. It's impossible to live.
Due to the influx of immigrants passing through the Respite Center, doctors try to see as many as they can. As he was seeing a family inside, the line outside grew.
So they're coming in with very common illnesses. So they're coming in with things like cough and colds, upper respiratory tract infections, sore throats. This morning we saw a lot of folks with diarrhea. So all of these things are very common even for my own practice.
Garza volunteered for about 2 hours today. In that time, he saw 36 patients. Channel 5 News witnessed him diagnosing adults and babies, like Rosa Cortez from El Salvador and her 2-year-old boy, Ángel Guerrero.
Okay. Yeah, el moquito. ¿Cómo está comiendo? Sí, eso bien.
The sicknesses were mostly sore throats, headaches, and diarrhea. Today, there was no need to send immigrants to local hospitals. That isn't always the case.
There's a few infections, so sometimes we'll see some skin infections that will require some urgent care. And so sometimes we'll see something like some cellulitis or an abscess that needs to be drained. Those kinds of things we don't do here, so we would need to send them to a different clinic.
Garza says the volunteers are doing the best they can to tend to the immigrants. They tend to be ready to face anything. Doctors must work without their patients' medical records. It is up to the immigrants to tell them their medical history. Garza says some of the immigrants that step into his office are afraid to share their health needs. He says it might delay their immigration process, but he urges them that once they step foot on this bus and reach their destination, they should seek the medical help. In McAllen, Christian Colon, Channel 5 News at 6.